If there is anyone who does not wish their video to be on, please turn it off at this point. We are now live streaming on Facebook. Welcome everybody from Silicon Valley Nagar Association. I would like to invite our president, Kinjal Butch, to open this meeting.
Hello everyone, Jai Hatkesh. It is I think today's, it is such a nice, it is an honor for me to introduce somebody who's, I have, what do I say? I'm related to him, but I've known him for ages now. And it is, I think the topic is such that I'm sure, and I hope that a lot of people listen into that because believe it or not, and unfortunately, I've come across so many people of late, actually. I think maybe because of COVID or whatever it is, so many people going through a lot of changes in their lives, and which is been very taxing for many of them. It's not been a smooth journey. So I think today's topic is going to be a fantastic selection. Thank you, Sharvari. Thank you, Kaushal, for selecting this topic. And I really hope a lot of people can take advantage of it. I see so many of you here who are related to me. I've known them for, known all of you for such a long time. People joining from across the continents. That is really an honor for us because for this calendar year, this happens to be the last of Otlaa Parishad. Until we, and then now, of course, the Navratri and all those celebrations will come in between. So welcome, Kaushal. And this stage, as we say, or screen is all yours.
Thank you very much. If this is the last session of the year, I would say that, thank you for saving the best for last, except that I haven't spoken yet. So
well, I'm not going to let you speak yet because I still want to introduce you.
Yes,
we want to let all our audience members know who our invited guest speaker is today. So welcome to Silicon Valley Nagar Association and to our invited guest speaker series. Today's guest is Dr. Kaushal Nanavati, MD. He is a doctor of integrative family medicine. He's an integrative family physician. And he's based out of Syracuse, New York. He's also a very well sought after motivational speaker. And it is in both these capacities that we have invited him to speak with our audience today. I want to give some idea of his many accomplishments to our audience. First of all, the thing that struck me the most was his very cheerful and his humorous way of speaking. It really is very endearing. It kind of envelopes you in right away and makes you feel as if, here's my doctor. Here's somebody I can talk to. Here's somebody I can share my burdens with. And that is so very important in today's taxing lives, in today's individualistic lives, in today's, in many ways, we feel very isolated, very alone, and the pandemic has not helped. So for such a speaker to come and to speak with us on the issues that he believes in, he's written a book. The book is called Core for Wellness, and he speaks of 4 different elements in this particular book. And I think that kind of envelopes his philosophy and the way he will approach the talk today. And these 4 core principles are nutrition, physical exercise, stress management, and spiritual wellness. Something that we can relate to as an Indian audience very well. This book is available on Amazon for all of us to see, and our host for this evening is our team members, Harsh and Suhani Vaishnav, and Shwetang and Maushami Trivedi. They will post these links in the chat for all of us to see. Let me give you a little bit more of an idea about Dr. Kaushal Nanavati. He speaks often on these 4 principles. He uses stories, vignettes, or anecdotes with real examples and his inherent sense of humor underlying all of them. He contributes to academic textbooks, especially in the field of integrative medicine. He writes in local magazines and has taught both physicians, families, as well as caregivers about end-of-life care. And like our president, Kinjal, mentioned, end-of-life is an area in which we all really don't know much about. We tend to ignore until we are facing it for ourselves or our loved ones. And so to have an overview or an insight into this field or in this area is going to be of a lot of use to a lot of people. Dr. Nanavati was born in Junagadh and he moved to New York at the tender age of 7 years, we can say. He attended Rensselaer Polytechnic Institute as a young man and graduated with a degree in biology, as well as with a minor in philosophy and literature. So we can say that both the right and left sides of his brains were working at the same time, which allows him to be the doctor he is and be the writer that he is and the speaker that he is. So he's a fourth generation doctor in his family. He did his medical studies at St. George's University School of Medicine. He's worked in the central New York's urban settings, as well as in the rural and suburban areas. With 25 years of experience in all stages of birth to life, end of life, he is the ideal speaker. We could have not found a better one to end our series for 2020 and 2021. He holds many hats, or he wears many hats. He's the Assistant Dean of Wellness at Upstate Medical University. He's also holding the position of the Director of Integrative Medicine Survivors and Medicine and Survivorship at Upstate Cancer Center. And he's the Assistant Professor of Family Medicine at Upstate Medical University. His family includes his wife and his son, and he speaks very fondly of them. He's involved, besides all of these, in athletic activities, and he has a family with many cousins, including our own president. Welcome, Dr. Nanavati, to Silicon Valley Nagar Association. We look forward to your speech. Thank you.
Thank you very much, but I think I'm going to be done now because you, the introduction you gave, I'm not sure I can top. I don't even know who that guy was, so that's very nice of you. Very nice for all of you to have me on, and I know we have a mixed audience, so we will keep this in English for the presentation. And what I can tell you is that this is like a mini family reunion for me, because I think a majority of the people, at least half or so far, are all relatives, respected elders, etc. So thank you for having me. This topic is very, very important. And there are so many cultural contexts, not only in terms of our Indian community, but then you think about within the Indian community, different sub cultures that we have. You think about world cultures and the fact that many of us live in an international environment where the culture of the society we're a part of may in fact have different norms than the cultures we have within our own homes. And so it's a tricky thing, and it's a fine balance that we have to try to achieve. And so I'm going to share my screen and then we will get started. Okay, so I just need some kind of I'm assuming you guys can see this. If not, you'll let me know. And so we're going to talk about mental health in the elderly. And honestly, you know, Shari Ben mentioned, you know, end of life care, etc. And so when we think about elderly, the first thing we start thinking about is they must be really old, right? And what I'll tell you is, and this may shock many on this because I'm still in denial, but depending on what definition you look for elderly, it can be 60 and older, okay? That's young. And the older I get, the younger that number seems to be. So when we talk about older, that's just somebody older than you. When we talk about elders, generally what we're referring to are people within a community or a subculture who are kind of a group of not only older, but also the connotation of wiser and respected within the community. And then we talk about elderly. And when you look at definitions, if you look online, if you look at different societies, first of all, it's a very vague definition. And one that was interesting to me was that there's between 65 and 74 are considered to be kind of the early elderly, and then 74 and above are considered to be later elderly. And so it's a continuum. And the way we think about it is, rather than thinking about an age as a number, think about functional ability, right? Think about independence versus dependence. And so I'll talk a little bit about that as well. But, my titles were introduced, dean and director and family physician, et cetera. But the other points she made, which actually are the titles that I'm more actually fond of, is actually the following, right? A husband. I've been married for 23 years, and about 5 years into our marriage, I woke up one morning and I woke my wife up at like 4 in the morning, and she's like, "What's going on?" I said, "You know what? I've just figured it out." And she said, "What do you mean? What are you talking about at 4 in the morning?" I said, "I just figured out that you're meant to be the guide in my life. I just haven't accepted it yet." And so, 23 years later, she still reminds me who the guide in my life is. I'm a father and I'm a son, right? And so our son is 19, and my parents, I live in Rochester with my uncle. I've written 3 books so far in this Core for Wellness series, soon to start the 4th. I'm the chief medical officer at Pep Talk Health, which is a patient engagement platform, trying to at least utilize modern technologies to engage with patients. Proud to be a member of Maureen's Hope Foundation, which is a local foundation that helps children with cancer and their families. I call myself a retired athlete. So not retarded, but retired. When I was competitive, one bad shot would ruin my day. I'd be thinking about it all day long. But with the retired mindset, one good shot, I've still got it, and I'm good to go. So as you say, how you frame it makes a big, big difference as well. And I put my Instagram and Facebook handles in case anybody who isn't already following wishes to. I don't really have time to troll you, so don't worry, I'm not going to be trolling anybody, but I often will put positive posts. So if anybody wants to follow, that's fine too. Right. And so let's get into it. Let's talk about the elderly, right? So when we talk about it, right, between 2015 and 2050, right, the population over 60 is going to increase from 12% to 22% of the world population. That's going from 900 million people to 2 billion people, right? That's a huge chunk of the population. And the fact that that proportion is actually growing means that we're going to have a whole population that's going to exponentially grow, that's going to require more supports, right? And I'll talk about why we think that they're going to need more supports. But when you think about it, more than 20% of adults 60 and older suffer from some type of mental or neurologic disorder. That's, more than 1 in 5, right? And depression is the most common. Then comes dementia, then anxiety, substance abuse, and actually 25% of deaths that occur from self-harm are in people 60 and older. And if you think about it, the percentage of the population that they represent right now is about 12 to 15%, and yet 25% are a disproportionate number of them oftentimes engage in self-harm, right? And that's sad. That's sad because when we think about it, especially in our cultural context, we think about things like multi-generational living. We think about, respecting our elders and the traditions of the Indian subcontinent and our community. And so when you get numbers like this around the world, many cultures, not only in Asia, but Africa, Europe, other traditions as well, have this context of generational living with generational support, right? And what's happened historically is it used to be that was the way, right? People lived multi-generationally, and that was just the way. Then it became an expectation, right? It was an expectation that, when we get older, the next generations will take care of us, right? Then there were assumptions, we assumed that that's what's going to happen. And now what we know, and especially being global, is that different subcultures, different families actually now have evolved into their own things. And so the things that used to be a foregone conclusion no longer are. And sometimes that also leads to a lot of stress and distress as well, right? So when you think about the risk factors for mental health difficulties and problems, right? One of the big things is loss in capacity and functional ability. As people get older, they start to have difficulty with some basic functions, walking, becomes an issue, right? What does this lead to? Well, when you're not able to walk on your own, right, now you become dependent, whether it be on a cane or a walker or somebody else, but it also starts to limit where you can go, how you can go, how you navigate. And so initially, some people, rather than be in the space of the public or society or family members, they'll start to withdraw, right? And they'll start not showing up at things, right? And that leads to the stuff on the other side in terms of isolation and loneliness, right? Loss in the ability to drive, right? This is a big deal. This is a very big deal, especially when you think about living here in the United States, right? Back in India, it's a different story in terms of not only public transport, but resources close by, etc. But here, for many of us, driving is an essential need. And when somebody can't drive, it becomes a very, very distressing feeling internally, because now they're losing their autonomy, right? Leg strength. So we know that as people get older, and especially 60 plus, their thighs, especially the muscles in the front, the quadriceps, tend to start to get weaker. And so if people are not maintaining strength there, then what ends up happening is when they try to get up from sitting, they may need to lean on the chair to get up or hold on to something to get up. And at the same time, the risk of falls becomes higher. And what we know with falls, and I know you had, one of my esteemed cousins who recently had a birthday, Dr. Nanavati, come on as well. And he's an orthopedist. When people are older and they have risks of falls, if they fall and have a hip fracture, the likelihood of survival at 1 year is 50% in the elderly, especially if they have a hip fracture. So again, very dangerous, right? Their reflexes start to get slower, right, or diminished. And so what ends up happening is, again, when they're in the presence of others, sudden reaction, especially with driving and that sort of thing, the risk of accidents is higher as well. And their cognitive ability changes so that it can slow down or get distorted in many ways. So when you think about slowing down, think about things like keeping accounts, doing your checking and finances, right? Remembering things like recipes or appointments or people's names, all those things. When you suddenly start to lose those things, especially initially, it's very depressing. And so that becomes a problem. And so this idea of isolation, loneliness, right? Their own sense of dignity and respect, those start to come into question first from the inside out. And then sometimes what happens is from the outside in, when people don't realize what's going on, they start to question that person's fortitude, their resiliency, their resolve. And then that can often lead to an uncomfortable situation within homes as well, right? The other thing that's a big risk factor is grief, right? Loss. The older we get, the more people we know are no longer there, right? More people pass away. The older we get, if we're still around and people around us are starting to die, that can be very depressing at times, right? And especially if you lose a spouse, there's really nothing to be said for that. And as we get older, sometimes parents losing children, that's not natural, right? That's not what we expect. We expect that we're going to go before they do. But sometimes the older we live, these situations happen, and that can be very depressing. And that type of grief is one that's very difficult. We know that in our communities here, especially in the US, local hospice organizations have grief counseling and grief support in most communities and in most counties, in many places, so that there are supports available, but it's still a journey from the inside out, right? The feeling of abandonment and loneliness, especially if somebody's living by themselves, right? Or they're living in a city that's away from their family, but they were independent. Now they start to not be as independent, and they start to feel alone. They start to feel isolated. And in some instances where relationships have suffered, now that feeling of abandonment even becomes bigger. That feeling of neglect becomes bigger, right? And that's also where their dignity and their sense of self-respect tends to come into question. So these are some of the issues that come up. Other issues that come up, also the loss of financial resources and stability, right? People think and they hope that they've saved enough for retirement, but then they get there and then suddenly their finances come into question, right? Or some people have made some choices with their finances where their cognitive function is declining, their judgment is declining, and they suddenly put all their money in, 1 or 2 stocks then the stock market crashes, right? And if they don't have any oversight or somebody guiding them, that could be catastrophic in terms of their quality of life and their potential of having a roof over their head, etc. Right? So that's important. And then elder abuse is a very, very sad, but very common, too common condition. So 1 in 6 elders experience some type of abuse, whether it's physical abuse, whether it's verbal, psychological, sexual, or financial. And these are real things. These are things that we hear about often. There are, resources through government in every county where technically, if you are actually aware of a situation such as this occurring, you can actually report it, and then they will go and actually check it out and look to see if they can support the elder. In some cases, they have to remove them from the situation, and or there's legal action that's taken as well. Historically, in communities where generally, large families lived in multi-generational houses, oftentimes abuse at different levels, whether it was spousal, whether it was elder abuse or child abuse, these were all things that were sometimes kept hush-hush because people worried about, society. And what they would do is just try to manage it within the home. But unfortunately, that led to people suffering in silence quite often. And I think we all know historically, if we look back to our own families and generations, you can think of people who may have actually endured a lot of this type of behavior, but society was different then, and society and the norms are different now. So it's important to recognize this, to pay attention to this as well, right? And so 2 of the most common conditions that I had mentioned were depression and dementia. So I want to go a little bit deeper into them. And then what I want to do is actually talk about the caregivers, right, who are taking care of these elders and elderly, and the fact that they also go through situations of stress and distress, and then how we can help both, okay? And then we'll take some questions towards the end as well. So depression, if you think about 3 words, the feeling of helplessness, hopelessness, and worthlessness. And the definition is that over a 2-week time frame, so over the last 2 weeks, if somebody has had a change in their level of functioning, thinking, that is more consistent with this type of thinking of feeling helpless, hopeless, or worthless, then you can classify that as major depression or depression, right? We actually have within our Indian and Nagar community especially, we have several psychiatrists who could probably come on in the coming year and talk even in more depth about these things. Or next year we'll see, maybe I'll make a live viewing, we never know. And I'm smiling as I say that too. So the common symptoms of depression, and this is important for a caregiver to understand, right, is changes in sleep or sleep pattern, right? Not getting as quality of sleep, okay? Or being too sleepy, sleeping more, right? Lack of interest in daily activities, right? So what they used to like doing, suddenly, I'm not interested, don't want to do it. Feelings of guilt, right? Or remorse, right? Over the past or over the current, or feeling overwhelmed about their own circumstance and situation. Loss of energy, change in mood, right? From whatever they were feeling to feeling more down, more distressed. Difficulty concentrating, right? Losing focus. Loss of appetite, not as hungry. No, I don't want to eat. I'm fine, I'm not that hungry, right? What we call psychomotor retardation or clumsiness, they start to trip, right? Or stumble, right, as they're walking, that type of thing, or bumping into things. And then suicidal ideation, thought of doing self-harm, right? If they have experienced 4 or 5 of these over the last 2 weeks, that clinically classifies depression, right? So these are things to just pay attention to and to be aware of. If you start to notice changes in your elder or the elderly within your home or within your community, it's a point of discussion, it's a point of connection to pay attention to. And if it's your own family and you have difficulty talking with them, then what you can actually do is talk to their health provider as well and let them know. And remember one thing, as a caregiver, you can always contact their health provider and let them know what you know. That doesn't necessarily mean that they can tell you what they know. Meaning, unless you're somebody's healthcare proxy and you have been given permission, or they have given permission to their health provider to be able to speak with you about their health concerns, the health provider in the United States especially can't just volunteer information to you. So don't get overwhelmed if you can't get the information, but you can definitely share the information and then speak with your family member as well. Or if there's somebody else that they have a more trusting or a closer relationship with, don't feel offended, don't feel badly, as long as they have somebody. That's the more important thing as well, right? We can't be that person for everybody. And sometimes there are just bonds within families that are different and more special. And from my perspective, the way I view it is, as long as they have somebody, even if it's not me, I'm happy that they have somebody, right? That they can either speak with or that they feel a close connection with, enough that they can share their intimate details, health information, all of those things with them and their health provider as well. So our ultimate goal is their sense of contentment and peace, their quality of life. And we can't be that person for everybody, but that doesn't mean we have to feel badly about it either, right? So that's depression, right? So now let's talk a little bit about dementia, right? Dementia is basically, we used to think times ago that if you use the word dementia, it equated to demented, which also meant crazy. Now what we know is dementia is actually a medical condition that has multiple potential causes. And it's basically when the memory starts to fade or their thinking ability starts to change, their behavior may change, right? And their ability to function changes, right? So 50 million people worldwide currently have a diagnosis of dementia. By 2050, that's going to go up threefold, 152 million people. And even then, this is a diagnosis is very underdiagnosed. So that's probably just the tip of the iceberg, right? And there are different types of dementia. So I'm going to share some stories here. So, there's Alzheimer's dementia, which is actually like a slow decline over time. Stroke, which oftentimes is like steps, right? Where somebody's got a level of functioning, they have a stroke and suddenly their level of functioning goes down. Then they stay at that level and then suddenly they might have another stroke and then their level of functioning goes down again. And so that's more like a step, whereas Alzheimer's is slow decline. Alcohol-related dementia is where sometimes people can't get the right words out, okay? So they know what they want to say, but they can't get that word to come out. There's a disconnect, right? Between the thought and the process of getting it into speech. Parkinson's condition, I'll talk a little bit about that as well. And then many others. So with Alzheimer's, I'll give you one of the most extreme examples I had. I had a lady who was in her 50s, and she used to come to me. This is early in my practice, maybe 3 or 4 years. I was a rural physician. And she would come to me and she fired me 3 times, but then kept coming back because she forgot that she had fired me. Okay. And so, I was very worried. And so I called a family meeting. And so she didn't have any children of her own. And so her nephews, nieces came, 4 or 5 of them came. And we had a family meeting with her and we talked about her health condition, which she didn't recognize at all. And then, the family asked if they could just speak to me, on the side. And so I went into another room with them. And when I was talking to the family, they said to me, we understand that, you've only met her in this way. And so you feel very badly for her. But we grew up with her actually emotionally abusing us. And so we have a very different feeling about it. It's very hard for us to feel any kind of empathy for her, right? Or to be sympathetic, because we've been traumatized since we were younger and she was just very nasty to us. And so we spoke about it. And the point was, if she's not able to understand, remember, and comprehend, then she really can't be living on her own. That wouldn't be safe. And so we were going to get social work involved to get her set up to be able to live in some type of senior housing. And so I had asked them to take at least her car keys so that she wouldn't be driving anywhere. And we had contacted social services who were going to be able to get to her within a couple of days. And during that time, one of the nieces lived 2 houses away and was going to go and check on her regularly. So they took the car. Actually, they were going to take the car the day after. And so then one day, about 3 days later, I got a call from the niece. And the very next day, before they took the keys away, this lady decided that she was going to go visit her sister who lived 20 minutes away. Okay. So except that her sister had actually passed away a few years prior of dementia herself. So this lady gets into the car, and we live in Syracuse, New York, which is about 4.5 hours away from Newark, New Jersey. And she drives where she thinks that she's going 20 minutes away. And this was after 9/11. And she ended up at Newark, New Jersey airport, 4.5 hours away. And then there was a police barricade at the time. They were, inspecting and checking everybody. So they stopped her car and said, "Where are you going, ma'am?" And she goes, "I'm going to Liverpool, New York, to visit my sister." And they told her, "You're in Newark, New Jersey." And she had no clue. She became very emotional. And so they were able to contact her family, who said, "Can't you just put her on a bus?" And to me, that's a very, very sad situation, because the police obviously said, "No, we can't," because she seems like she's confused and disoriented and demented. And so ultimately the family went down to get her. And then we were able to work through the social work in the hospital to get her situated. And within 6 months, she actually passed away. She had an aggressive form of dementia that was very rapid. But a sad situation where somebody who had no supports, and it was difficult for the caregivers because they remembered, even though she didn't, the relationship that they had, right? And so that made it difficult. I had another gentleman who actually, and this was more of a heartwarming kind of story. This was a gentleman who started to get demented, and his wife was noticing him. Now, often what happens with dementia is, for the caregiver, initially, they feel like, "Why am I repeating myself?" And they start to get frustrated. But for that person going through dementia, for them, every time you tell it, it's the first time, right? So they don't know, right? And this gentleman, whenever you asked him a question, if he didn't know it, the answer, he would just say, "That's life," and he'd smile. And that was his standard response. So he used to have a hot dog every day, and he had his dog that he would go, play with. And those were his things. And as he started to get more demented, he started to forget about the hot dogs at lunchtime. And that was very emotional for his wife. And then when his dog passed away, he forgot, actually. And so he would keep looking for the dog because that's what he remembered. And with dementia, what happens, especially with Alzheimer's type, is recent memories start to fade. So people keep living further in the past over time. And sometimes it gets to the point where they don't remember their spouse either, right? So they may not remember their children first, then they may not remember their spouse. And so that becomes very, very emotional for the family. And at the same time, for the person, they don't remember. So to them, it's not distressing. They just don't remember. Early on in dementia, they also get depressed because they recognize that they forget. But the saving grace of advanced dementia is that people don't remember. So they start not remembering, which means they start not suffering because they forget even things like physical pain. They forget relationships. They forget traumas, emotional traumas, all of those things. And so it becomes a completely different situation, right? So again, there are different types, but when we start to recognize that, if we're starting to repeat ourselves, or somebody is repeating stories, right? I have one patient who comes in and I'll say, "Did I tell you about that time?" And it's usually the same story. And so I'll say, "You know what? I don't think so." And then he'll tell me the story. Or if I say, "You know what? You told me that last time." Like, "Oh, really? Yeah, I don't remember telling you that. Let me tell you about it anyway." And then we'll listen to the story. So it's a unique thing. But the most important thing as a caregiver is to, one, recognize the potential of it, get a good evaluation, and then to be patient with them, because this is not something somebody's actively doing. This is something that they don't have control over because the connections in the brain just aren't remaining, right? And that's the issue, right? Parkinson's disease, oftentimes people actually start to have a flat expression. So there are four main things, right? So they start to have what we call rigidity. They become more stiff. There's a specific kind, what we call cogwheeling. So it's like a choppy kind of, if you move their arm, they actually go in a choppy kind of manner. Then their affect is actually flat, and they start to shuffle when they walk. So they're kind of like shuffling, more so than actually taking steps, right? And they get what we call a pill rolling tremor. So if their hands are just resting, then it's sort of like just like a pill rolling tremor as well, right? This kind of a thing, okay? So again, do I expect you guys to know all of these things and to memorize all this stuff? Absolutely not. But the point is, if you notice a change in behavior, if you notice a change in attitude or their affect, the way they express and their facial expressions, these are all times to at least just pay attention and start to seek the supports that can benefit you in caring for them and benefit them in maintaining their health as best as possible, right? So the differences between depression and dementia, demented people make up fast, right? So you ask a demented person, you know, hey, who's the president, right? And they say, oh yeah, that good old Ronald Reagan, you know, he's a great, yeah, you know, he's the governor of California just last year. And so they will make it up. And to them, it's the president, it's the reality, right? Depressed people, when you ask them a question, they'll kind of, you know, have a different expression about themselves and they'll, I don't know. And they'll just say, I don't know a lot of times, right? The other thing is with demented people, they'll tangentially just carry on a conversation wherever it goes. And, you know, whereas depressed people may just shut down, just not respond, not answer. Right? So these are other ways that we can kind of differentiate dementia from depression, right? And so for caregivers, what happens is when we start to see this, we get depressed. This is our loved one, right? And they're getting older, they're becoming less able. These are the people that we idolized, you know, growing up possibly, the people we've looked up to, the ones that have raised us. And suddenly they're becoming more needy, they're becoming limited. And what that calls into our mind, and for them and for us, is the finiteness of life, right? And that they're getting closer towards their last days, right? And so some people actually start to live as if they're dying, right? And the motto is live like you're living, not like you're dying, right? When the day you die, you're dead. But until then, you're alive. And if you're alive, why not live like you're living? And that's a mindset, right? It's a mindset that all the great books teach. The Gita teaches it, the Bible teaches it, the Quran teaches it, the Old Testament teaches it. Buddhism is all about that as well. And so it's about appreciating and embracing the moment, right? This idea of the present. So most people are depressed about a past they can't go back and change, or are anxious about an anticipated future. And the process, they keep missing out on the living moment, the present moment, right? So caregivers can start to feel depressed about, you know, what they're seeing as a transition, and sometimes get anxious about what'll happen if, right? And that can lead to a lot of stress, right? Caregivers often have to juggle responsibilities. So for some people, depending on stage in life, they might be taking care of little ones, and they also end up having to take care of their elders, right? Or the elderly within their home, right? So what we think about is in these moments, recognizing that sometimes initially, especially, it can be overwhelming, but that's also the time where we look for our own supports. And sometimes if somebody's a single person, right, a single parent trying to take care of their kid and their parent, that can get very, very overwhelming. And so making sure that we're connected with the resources, either in the community and aware of them, is very important. One of the best resources, especially for our elderly, is sometimes if they become very dependent or limited, are senior groups within the community, and also day hab programs where they actually have activities for seniors, and you can actually drop them off in the morning and pick them up in the afternoon or evening, and during the daytime, they'll actually engage in activities. So they can still be at home, but have some of the benefits of what oftentimes we talk about nursing home environments and those things, where there are activities during the day where they can engage with people, you know, either of their own generation or just others. And so they have socializing that happens as well, right? So that's important. Caregivers often start to lose time for self-care because they're always busy caring for the elder. And sometimes the elder may be very needy, right? They may be emotionally distraught and scared, right? And so they start to get more clingy, right? So there's a curve that we talk about. It's like almost like a bell-shaped curve between infancy to level of functioning at adulthood, and then level of functioning at the elderly level. And again, as I say, elderly isn't a number, it's a level of functioning, but they start to function more and more like children, but have all the life experience and the pride, right? And their own ego about who they've been, that now gets questioned, and that gets to be very frustrating for them as well, right? There's potential for abuse from both sides, right? Emotional abuse can come in many different ways, and sometimes the dependent elderly might start to use guilt as a means to try to hold on to the caregiver from leaving them alone because they're scared of isolation and loneliness, right? Sometimes the caregiver may emotionally abuse the elderly, right? And so again, these are important things to pay attention to. Burnout is real. Burnout, the term itself, is actually an occupational term. So you can't burn out from home, but you can burn out as a caregiver because it's actually, even though it's not for many people an official job, it's a job, right? It's a job. You're taking care of somebody, somebody who was your elder who actually possibly, bathed you and clothed you when you were younger. Now you had to, clean them after they have a bowel movement, or wash them up in bed, right? Or change their clothes, feed them, right? And these are all things that sometimes get to be overwhelming, right? So we have to learn to pace ourselves, but also to take care of our own self, right? I'll give you a nice, beautiful example, actually. This is not textbook, but a couple of months ago, I had a patient of mine who was a caregiver, and she was taking care of several relatives and just giving and giving and giving. And so she was feeling really stressed and lost. And so what we talked about was that the human heart is pretty smart. It's a giver, right? It gives all the time, gives blood to the body all day long, right? Our entire life. But the heart's pretty smart. It's got these coronary arteries so that every time the heart beats, it feeds itself first so that it can keep going. Otherwise, it couldn't keep going and the body would be done, right? And so we can learn so much from our own body, right? And this heart, which has learned to be selfish, right? And that's not a bad word. In our culture, selfish is thought to be a bad word, right? But selfish is good when it's self-care, self-love, self-respect, right? It's bad when you step on somebody else to get what you want, but it's good when it's self-care, self-love, and self-respect. And so most of us, if you actually think about it right now, most of us aren't selfish enough, right? Are we optimally taking care of ourselves? If you can actually say yes, good for you, right? But many of us, much of the time, aren't always optimally self-caring, self-loving, self-respecting. And in this situation, it works both ways. We want to encourage our elders to be able to feel that way, but we also need to be able to feel that way, right? And sometimes there are financial stressors when you're taking care of somebody, all the resources that are required, and sometimes they may not have the finances, right? And you're trying to respect their wishes. And so you may have to utilize your own resources, but that's also sometimes limiting because you also have a house or a household to maintain. You may have other financial concerns and obligations, right? And so again, it can get very tricky. Again, in the United States versus Australia versus India, there are different ways and different resources that are available. You want to make sure that you understand what resources are available in the community. Actually, one of the big things to recognize is for your elders and elderly, how their finances are arranged, because sometimes that can make a huge difference in how you can access resources, and also so that they don't completely lose all of their life savings as well, right? And that's important, right? So that makes a big difference. And so how do we help, right? Listen to understand before you respond, right? Listen to understand. Most of us listen to respond. The minute somebody starts talking, we're thinking about our response. But actually to be able to listen to understand first allows you to get context, right? Understand perspective, understand where they're coming from, right? And when you can see that perspective, sometimes the comment that is coming at you actually makes a little bit of sense. Doesn't mean you have to even agree with it all the time, but taking the time to understand first before responding shows not only respect, but allows you to respond more appropriately versus reacting, right? So we'd rather respond, than react, because reactions sometimes become quick emotional reactions, right? But a response is one that takes that information, processes it, and then gives an appropriate response, right? Understand and pay attention to their life story, right? Oftentimes the elderly are reminiscing, reflecting, but they have a whole life history, right? And many of us don't fully know it. So take the time to get to know their life story. Not only is that respectful, they'll appreciate the time you took. More importantly, you'll understand how and why they think the way they do based on their living experience and their perception of their living experience. So from the outside in, you might say, you know what, he's had a great life. Like, I'm not sure why he's so sad or depressed, or, you know, what he's bitter about, right? Grumpy old man, right? But the point is, that's your perspective on their life. Do you actually know their perspective on their life? And if not, it's a very important thing to pay attention to, right? Recognize the signs of concerns that I talked about and help them achieve closure. A lot of times, the elderly are depressed, are remorseful, right? Are regretful. And oftentimes that comes with not having had a chance to get closure. And sometimes getting closure is about acceptance and forgiveness, which then lead to contentment and peace. And sometimes it's accepting and forgiving yourself, right? For choices you might have made in your life in the past. And I mean that for the elderly, obviously for all of us as well. And so achieving closure allows us to have a sense of peace, right? And that's very important as well, what we call shanti, right? Engage them in shared activities, right? They're isolated, they're lonely, right? And oftentimes engaging them in activity, right? And they may even initially just, you know, say, no, no, no. And they may kind of give you a little bit of hard pushback. But as you get them engaged, or at least keep offering, right, the opportunity to engage, that allows for a connection, right? And treating them with respect, right? Without giving up your own sense of self-respect. This is important. So it's important to set boundaries because many of us who are caregivers are also at middle stages of our life. And so it's not that we haven't lived our life, but we also have a life to live. And how do we respect our own journey while also respecting theirs? It comes with communication, relationship building, and that's really, really important as well, right? So as I talk about this, we think about, so if we're talking about mental health, we're talking about depression, dementia, and how we as caregivers can help, right? What is actually well-being? What does that mean? And it's not as complicated as one might think, right? And so let's talk about well-being. It's broader than just happiness in this moment, right? Your well-being, right? It's personal, right? It's personal, and it means different things at different stages in our life, but it includes happiness and also how satisfied we are with our life as a whole, right? And this is important for everybody who's listening to really, really think about, is how satisfied we are with our life as a whole. And we should reflect on that, right? Your own sense of autonomy, right? A sense of control over your own life, right? And then having a sense of purpose, right? So with children, we no longer ask them what they want to be when they grow up. We ask them what they want to contribute, right? Because when we ask that, it allows them to think about what it is that they want to do that's purposeful, right? What meaningful contribution they actually want to make. But that's important for all of us to think about. Many of you on this call, I know, and I admire the meaningful contributions you've made, not only socially, but within our own families over the years. And, you know, when we know people like that, it emboldens us to actually step into it and do it for ourselves as well, right? So thank you for what you've done so far, right? And then potential drivers, and this reinforces, right, what I was just talking about. So external drivers, income, housing, right, education, and social networks. One of the biggest factors for sustained happiness is actually meaningful relationships, right? And that doesn't mean 100 of them, right? It can be one, but when people don't have a feeling of having a meaningful relationship, that's more depressing for them, right? So again, more often than not, especially in our cultures, our parents tend to want to have a strong bond with us. And sometimes we get busy in our own lives, right? Take the time to pause and just give them a call if they're not living with you or they're in another country, etc. Take the time to connect, right? Express appreciation, again, a cultural difficulty, right? To say I love you, right, is something that's very difficult in Eastern cultures, in many Eastern cultures, but in many cultures as a whole, right? So as I see all of you, I say, I love you, right? And some people feel awkward about that. Some people feel like, well, what are you talking about? What kind of nonsense is this? Is this whatever? The reality is we need to express it more, right? Especially when people are getting older, they need to hear it more. They need to feel it more, right? We need to share it more, right? That's very important. And then the internal things, health, optimism, self-esteem, right? So how does that work, right? And this is a nice diagram because good feelings day to day and overall, right? Happiness, joy, contentment, satisfaction, they're kind of fueled by our level of functioning, right? That autonomy, that competence, feeling safe and secure, right? People feel unsafe when they're by themselves and isolated and lonely, right? And those are connected to external conditions like, material conditions like home, environment, social context, right? How you live, where you live, community around you, right? Resources, neighbors, neighborhood, all of those things. And then the personal resources of health and optimism, self-esteem. When we're happier, our self-esteem is better as well. Our optimism is better as well, right? And so that matters. And so these are 5 concepts, and give me about 8 to 10 more minutes and we'll be done. We can take some questions, right? But the 5 ways of well-being, this is all evidence guided, right? So the first thing is connection. And again, this reinforces a lot of what I've mentioned. Strengthening relationships with others so we can feel close to, right? And valued by them. Well, if I'm not feeling it and they're not giving it, then it's hard, right? So as a caregiver, I want to express my sense of appreciation. I want to express respect. When they do something or say something that's insightful, to be able to say, hey, that was great, that's a good point, right? When they make a suggestion, right, respecting that they were able to make a suggestion. Now, does that mean that we have to do everything that they tell us to do? Well, it doesn't always work that way, right? But to be able to at least give them the opportunity to express allows for better communication, which is one of the keys to relationship, as I'll show you, right? Be active. Physically active, right? So I have an 88-year-old gentleman who still goes to a golf course and tinkers around their shop, with their equipment and machines a little bit. He no longer does any of the heavy lifting, but he'll get on the tractor and do some of the mowing, etc. And he shows up as he can. He goes for a half a day, 3-4 hours. They appreciate him coming. He likes being engaged and involved. And I talked to him this past week. And you say, I'm still going. Maybe next year I'll quit, and maybe I won't. Depends on how I feel. Good, great, right? He's functionally able, and so he should continue to engage, right? Give, carrying acts of kindness, right? Whether small or large, increase happiness. As a caregiver, take a moment to appreciate the fact that you are giving care to your loved one, that you have the ability to be able to do so, right? That's important. Taking notice, paying attention of the present moment. If you're sitting in their presence, think about your life's journey with them, right? What a journey it's been, right? For many of us, multiple continents, right? It's, going from having things to having nothing to having things again to having nothing, multiple cycles in our own life, multiple stressors we've endured, multiple joys we've endured. All of those things are opportunities, right? They're memories that build a life together, right? And then keep learning, right? Stay curious, learn more about them, learn about their life's journey, learn more about how you can help them, right? In fact, let me give you a cool fact, right? So in nature, right, there are 7 to the 27th atoms in the human body, right? There are 10 to the 28 stars in the known universe. Now, to me, this blows my mind, right? What this tells me, inside each of us is the entirety of a universe of its own. If you read the Upanishads and the Vedas and it's all written, right? It's in the Bible, it's in the Old Testament, it's in the Quran, it's in Buddhist writings as well. We are the entirety of it, right? In fact, if you think about a black hole, right, where pretty much nothing escapes, think about the pupil of your eye, right? So wherever you look, nothing escapes it. So maybe if you want to know what's happening on the other side of a black hole, think about what's happening in information, right, as it goes through and how that's being connected. And maybe we'll have a better idea of what's happening on the other side of black holes, right? So there's a lot that we can know from our body. And I'll give you one last example about the heart at the end. So don't go away, right? So to talk about quickly the core 4 stuff, which is really the nutrition, exercise, stress management, spiritual wellness. There's the Harvard Healthy Eating Plate. Parishad, if you want to just put that in the chat, Harvard Healthy Eating Plate is probably one of the best nutrition resources. And what they do is take all the evidence from all the literature around the world on nutrition to come up with the best way to eat, right? And the fundamental foundation, if you remember nothing else about nutrition, 7 to 9 servings of vegetables a day. It's a lot, right? And we think, well, yeah, I'm a vegetarian, I eat that. Well, think about what you're eating and see if you're actually getting it. So 1 measuring cup of raw or half a measuring cup of cooked is 1 serving of vegetable, okay? And what do we know about that? Well, let me tell you, this was published in 2014. Fruit and vegetable consumption and all-cause cancer and cardiovascular disease mortality, right? So this is a survey of data from England, and they looked at 65,000 plus participants, right? So this is legitimate information. And if you look at the conclusion, basically what they found was that the more fruits and vegetables you had, and specifically more vegetables, less fruit, but the more of those you had, the better your risk profile was. And just this past week, I saw a study that said for every additional serving of vegetable you have, you reduce your risk of heart attack or heart disease by 20%. Okay, that's a huge number. Okay, so 7 to 9 servings of vegetables, 1 to 2 servings of fruit a day. Okay, why less fruit? Because of the sugar factor and what that has as an impact on things like obesity, etc. Within the berries, within the fruit, berries are your lowest glycemic index food. So if somebody has diabetes, they probably should only have 1 serving of fruit, but for them, berries would be the optimal fruit to have. Okay, so keep that in mind. Right, physical activity. Right, embrace your chassis and keep your engine finely tuned. Not all of us can look like those, Instagram and Facebook, edited pictures and etc. So, embrace who you are, right? And just focus on your best self, right? So, if you look at a parking lot, not all the cars look the same. There are minivans and there are sports cars and there are SUVs and there are sedans, right? All of us have different bodies. But if your engine is finely tuned, which is from the inside out, then you can manage your body much better, right? If you think about it, 40% is what we do, 40% is genetics, 20% is just happenstance, right? So, sometimes I look in the mirror and I blame my genetics. Sorry, mom and dad. And sometimes I smile, but the point is, do the best you can to take care of your health. Be active. The goal is to get 7 hours of moderate intense activity per week, okay? Moderately intense means going hard enough that you can speak in small sentences, but not so you can have a longer conversation and not so you're going to pass out, right? So it's variable up to you depending on how you feel that day. And as little as 10 minutes at a time is heart beneficial. So you don't have to do an hour at a time, but you want to try to get that total of 7. And anything more than 30 minutes in a week is protected. In fact, the World Health Organization says that they looked at a study of 144,000 people who had 7 hours versus people that got less than 30 minutes a week. The ones that got 7 hours had a 40% lower chance of premature death from any cause. There's no pill in the world that gives you those odds, right? Stress, right? Stress and then your sense of spiritual wellness, right? So this is a mug that actually my chair had when I first joined Upstate 10 years ago. And that year, I would see this every day. This was his mug, right? Same mug, basically. And then that year I turned 40. And when I came home that day, my wife handed me a box. When I opened it, right, before I even opened it, my son said, "Oh, you're going to be 40. It's a Hallmark birthday. What do you want to do? Go to Hawaii? Let's do something, And I said, you know what? I just want some peace, right? And next thing you know, my wife hands me a box. I open it. It's the same mug with the same saying. And she had no idea that I was seeing it for the last 6 months at work, right? Peace. It does not mean to be in a place where there is no noise, trouble, or hard work. It means to be in the midst of those things and still be calm in your heart. Life is a journey, right? In fact, if you think about it, they say in Buddhism that the Buddha said life is suffering. And once you accept that, then, you will reach enlightenment and get towards nirvana and all of that stuff. Well, what if the word suffer wasn't S-U-F-F-E-R? What if he meant suffer as an S-A-F-A-R, which in Arabic and in Hindi means journey? What if he was saying life is a journey, right? Embrace it, right? And understand relationship, right? These are the things. If you're in a relationship, you're like the 2 posts held together by these rungs: commitment, compromise, honesty, forgiveness, communication, right? Acceptance, love, caring, availability, sharing goals, trust, mutual respect, right? And what happens is if those rungs aren't reinforced, the 2 posts tend to drift apart, right? And it takes effort from both sides. You can't just do it from one side, otherwise the other post will drift too, right? And so that's important. I thought I was a genius making this, slide about 10, 12 years ago. And then a couple of years ago, I was making a slide for medical students and I was looking for an image of a ladder. This is DNA. right? In the body. Again, the body teaches us so much. DNA, these two posts are held together by the rungs, right? ATCG, right? If anybody remembers or is in science, right? And so the point is, this is the building block. This ladder, this relationship ladder is how we actually remain in existence, right? And if our body is recognizing how to make it work, how can we not consciously make the right choices to make it work? Right? And so if you feel like you have a mind full of mess, not just right now, because everything I've been saying, but when you feel stressed or overwhelmed, just take a deep breath. And in fact, the most important thing about things like meditation and all of that, if you haven't learned how to breathe, let me teach you now. If you put your hand on your stomach, when you take a deep breath, your chest doesn't necessarily need to rise up and down, but your stomach, your abdomen, should push out like a balloon when you breathe in, right? And when you breathe out, the belly comes back in. So when you breathe in, your belly pushes out. You breathe out, the belly sucks back in, right? And you breathe in slow, you breathe out even slower. But anytime you feel stressed, even if you just take one deep breath, the longest, slowest, deepest breath you can, and then breathe out even slower, in that moment, suddenly, you'll be thinking about the breath and not the thing that was stressing you out. And so you created a fork in the road. Now, if you liked what you were thinking about, go back to it. But if you didn't, now you have an opportunity to change, right? And what I do is I have a data bank of all these wonderful, beautiful memories, from years gone by. Even some fake, I think I have one that I'm not even sure is true. I have this memory of my son running around in a wet diaper leaking when we were trying to, catch him to change his diaper. And I don't even know if that's true, but boy, it makes me smile now. I'm sure at that time I wasn't smiling. But, I can always think about that and suddenly I'm smiling again, right? And now my mind frame changes, and even change of thought actually has a huge difference. And this deep breathing actually has great science. And I'm on my last couple of slides, right? So this is a science, right? She introduced me as a doctor, MD, figured I'd give you guys a little bit more science here as well. But 10 minutes of belly breathing, right? Forget the mantras and the yoga poses and all that stuff, just that deep, slow belly breathing, and cortisol, the stress hormone, goes down. That affects blood pressure, blood sugar, inflammation, your immune system, and what we call oxidative stress or precancerous change. This thing called DHEA is a hormone, goes up with meditation, that actually has some anti-aging effects. Normally it goes down after the age of 40, right? Serotonin, so Prozac and these things that help our mood, serotonin goes up with deep breathing. That actually has more receptors in your intestines than the brain, right? So I know another Dr. Nanavati is on the phone here, Shardul, is a gastroenterologist, right? And he can tell you, so with serotonin, your gut motility is affected, which impacts nutrient absorption, toxin release. That gets converted to melatonin, right? Which people use for sleep, but that actually has a benefit for your immune system. Dopamine goes up. We can get you all doped up just by breathing right. And adrenaline, our fight, flight, or freeze response, calms right down, right? So any given moment, one deep breath, 10 deep breaths can actually avert an anxiety attack. Then 10 minutes and all this hormonal change starts to happen as well, right? Harvard looked at people who averaged 24 minutes at a time. And what they found was that at the end of 8 weeks, they were doing functional MRIs of their brain, looking at the energy and the density in the brain. By the end of 8 weeks, the density in different parts of the brain had actually changed, right? Just with breath. Why? Because with belly breathing, we get more oxygen in, we blow off more carbon dioxide compared to chest breathing, okay? And so this is the last slide, right? Our thoughts, and this is 2017, our thoughts modulate the expression of what we call inflammatory genes. So literally, right, what you think impacts chemicals in the body that affect the way blood flows through your arteries, especially those coronary arteries in your heart, right? And so stress, distress, anxiety, fear, right? What the Gita calls all the modes of ignorance, if you want to say that. Those are all the things that elevate cortisol, right? Trigger tension in your arteries, trigger inflammation, right? Trigger distress, right? And so we'd rather de-stress than distress, right? At any given moment in life, we have two choices. We can choose to be at peace, or we make the other choice, but the choice is always ours, right? We can't point the finger elsewhere. We get to make the choice. And so I'll give you the last story of the heart, and then we'll get into the questions, right? The human heart beats 86,400 to 144,000 times a day, okay? Now, every time the heart beats, it sends off blood, right? Doesn't know where it's going, doesn't know what it's going to do, right? Doesn't even know if it's going to be received or not. And yet it keeps on giving, right? Unconditionally. And we use the symbol of the heart for love, literally giving love unconditionally, right? And when that blood comes back, it doesn't know where it's been. It doesn't know what it's done. It doesn't care what shape it's in. It opens up, embraces it, nurtures it, and then releases again, right? And so if our heart can do that 100,000 plus times a day, how can we not be the embodiment of that, right? And so whenever you feel stressed, distressed, frustrated, right? And even for our elders, this is a good reminder, right? Whenever they feel overwhelmed or distressed, recognizing that our heart is showing us the way to love unconditionally, which means giving without expectation of how it'll be received, whether it'll be received, what'll be done with it, right? And receiving as is, right? Receiving them as they are, receiving the message as is, right? Without condition, limitation, right? And when we can start to learn to be this way, the living experience, right, is a unique one. It's a different one. And that actually allows us to have a greater sense of what we call santosh and shanti, or contentment and peace as well. So with that, I'm going to stop, and I'm going to stop screen sharing, and we can get into questions or if there are any comments.
Thank you so much, Kaushal Bhai. That was an extremely interesting talk. And, it's so hard to bring up all of these difficult dialogues, as I call them all the time. They're very hard to discuss. We rarely do spend time to discuss them. So it was all the better that you brought out so many observations. We have a number of questions. And Harshan Suhani, Vaishnav, as well as Mausami and Shwetang Trivedi are helping us to host today, and they will bring out the questions.
I think the first one that we have is from Advait Bhai Majmundar, and he's asking, is there a guide to write instructions for beneficiaries other than living trusts? He's referring to information about investments, credit cards, house papers, etc., where the trust will kind of keep your information for you. There was one answer from, I think, Sharvari auntie, and she was mentioning something about advanced directive. But yeah, if you have any other resources, you can talk.
So things like advanced directives and even living wills, and these are things that are very valuable to have, because people have the opportunity to express exactly what they want to do and how they want to do it, and where they want their finances distributed, resources, home, etc. The most important thing to recognize is that the best place, the best person in situations like this would be actually a lawyer who handles this, estate trust, estate lawyers, because they're very familiar with changing regulations. So things like a healthcare proxy or a living will or advanced directives, these are all things that oftentimes for advanced directives, you can get forms from the doctor's office as well. But in terms of recognizing what the limitations are, what the potential is, and how to navigate and negotiate them, it's so important to have this paperwork. And actually, anyone over 18 should have something, right? If nothing else, at least a basic will. Because if that stuff isn't said and somebody passes away, then what happens is now it goes to the courts. And that can delay process by months at times. So the best advice I can give, you can speak with their doctor, but the best advice I can give is actually to speak to an estate lawyer or somebody who handles this, because the laws in different states are different. And while there may be some national consistencies, you have to work state to state on some of this stuff as well.
Thank you. I hope that answers your question, Advait Bhai. Next one we have from Kavyendu Bhai, who's asking, with dementia or depression, how can one keep control of it?
Well, that's a life, right? So with dementia, the main thing is when we think about things like Alzheimer's, when we think about stroke, again, with strokes tie into cardiovascular disease. So obviously healthy eating matters. With healthy eating, we talk about, avoiding greasy fried foods. For people that are meat eaters, processed meats increase the risk of heart attacks and strokes by 30%. And so generally speaking, it's about healthy eating. So the 40% of what we do comes into the core four: healthy eating, staying physically active. That actually helps with both depression and dementia. When you eat foods that are more colorful, that helps with depression as well. When people are worried about things like nutrients or nutrition and specific nutrients, we think that turmeric actually has a great benefit for Alzheimer's type dementia. In fact, there was some data years ago that showed that India had some of the per capita lower rates of Alzheimer's type dementia. It's thought to be tied to turmeric, because that reduces the potential of those plaques and tangles that form with Alzheimer's disease. So fundamentally, to optimize your quality of life when it comes to depression, when it comes to dementia, it comes back to those fundamentals of optimizing your nutrition, physical activity and exercise, staying engaged in relationships and community, living purposefully, and trying to maintain your sense of autonomy as much as possible. Okay?
Thank you. And I think the next one we have from Deepak Bhai Mankodi from Australia, and he's asking, can the Sanskrit effect help alleviate issues connected with mental health for the elderly? And by Sanskrit effect, he means practicing or reciting Gita or Sanskrit shlokas every day.
So there is good science with some of this. So this is a deep, deep question, which definitely can be a whole conversation about. So when we think about reciting the Gita, when we think about prayer and the power of prayer, when we think about specific mantras and what they're meant to do and what they're meant to be, that starts to get into even things like how you recite them, right? So there's the idea of proper pronunciation, enunciation, tone, vibration, and all of these things. There's some science, some people might call it pseudoscience, but actually there's some data coming out of the impact of vibration, expression, and most importantly, when you create that type of focus for yourself, it allows you to maintain a sense of calm, a sense of peace, a sense of fulfillment, and those are things that help us to feel better, so that we're not feeling as low or as depressed, right? So people that engage in consistent practice, right, of any kind, but definitely those that feel a connection spiritually, and then they're engaging in that activity, they feel satisfied. And when they're satisfied, they're contented. And my feeling is that all we need in life are two things: contentment and peace. Everything else is a want. And if any of your wants take away from your contentment and peace, think about where your priorities lie. Because if somebody is contented and at peace, the next moment is bonus, right? So whether you're there or not, doesn't matter, because if you die, you died contented and in peace. So we talk about longevity. Really what you want to think about is, how are we valuing these moments, right? So between this moment and this moment is really an infinite amount of time. How are you valuing it? And more importantly, if you're contented in peace and you die at 50, was that a sad death? No, it was not. But if you're 80 or 90 and you're not contented and in peace, has it been a sad life? Possibly, right? And so you want to think about it. It's one thing to recite the Gita. It's one thing to read the texts. Are you living it? Are you living it out? And if you're not living it out, what are you reading and what are you gaining out of it, right? So if you're reading words on a page and not applying them to your living experience, what are you doing, right? Then the wisdom, right, of what the great books teach. All the great books teach about one word, right? It's love. Every society, every civilization has come to the same conclusion, but the next civilization won't use that as a launching point. They want to go back and prove it for themselves, just like a teenager who won't listen to their parents until they become the parent. Now they're saying the same thing, right? At some point, we can actually gain the wisdom of learning from their conclusions rather than having to try to reprove them, and actually living them out to get to that next level. And if you ask me, that love actually brought me to the awareness that unconditional love is the master key, but it's applying it, right? It's living it out. So it's wonderful to engage in the activity, but if you're not applying it into your own living experience in the way in which you engage in relationships, then I think people are missing the point.
I think that definitely makes sense. And I think the last question that we have came in when we were talking about the fact that we should have 7 portions of vegetables. So I think the question is, how does the Indian thali compare with that?
The Deshi Thali, let me tell you, that was wisdom, right? So when you think about Ayurvedic eating and all these things, right? The fact that the thali or the plate for the non-Indians in the group, thali is a plate, right? And so the typical traditional thali, right, if you think about it, had, you know, some raw vegetables, what we call kuchumbar, right? Then it had some shak or vegetables or sabji, right? Then you had some sprouts, right? And you had some atarn or pickled vegetables, right? Then you had dal or lentils, right, or pulses. And then you had the 100% whole wheat roti, chapati, right? And then you had yogurt or buttermilk and water, right? And then sometimes you'd have even the gore, or right, just a little bit of jaggery or molasses, which is a digestive aid as well. So when you think about that, it was the most comprehensive meal, right? Because what you're supposed to do with vegetables is 80% raw, 20% cooked, but also a tablespoon or two of pickled vegetables because they help to digest insoluble or harder to digest foods. Then you have the lentils, right? You got proteins, right? Within which you have ghee, which is a healthy fat, right? You got sprouts, right? And then you've got the yogurt and buttermilk, which is probiotic nowadays, a big deal about probiotics, right? So in our tradition, it's just water and yogurt and you just churn it and you can put in some, you know, masala in there, or you can make it sweet or salted, right? But in Iran, they actually take the same yogurt and they put club soda with some mint. They call it doogh, right? There's kefir. So there are these probiotic oriented drinks that have been around the world. But if you're asking me about a thali, the ideal thali was actually a perfectly balanced meal, which nowadays we kind of, and pardon my language, in many ways bastardize it, because we'll either just have, you know, dal chawal, or we'll have roti shak, or like the you know, the chapati and the vegetable. And the reality is there's a nice balance. If you have fiber, healthy fat, and healthy protein at every meal, that's actually a healthy way to eat.
Thank you. And I think that's all with the questions from the chat, unless if anybody has any right now, you can raise your hand, or I'll ask Sharvari Aunty to continue.
Well, thank you
So
very much.
there's one question that came up from Adwait Bhai. One question
Yes.
is, you know, who answers the question, where is the property? This is not in the advanced directive. It's true. And again, this is the kind of thing that probably the legal people would have a better awareness of what to do, because sometimes, and this can get very tricky if there's stuff that's not known, you end up having to go to the county and or to the register, where the county registrar, where they have all the records and stuff, and then that becomes much more of a legal thing that you have to deal with as well.
Thank you. And some of the conversation today actually brought up really important topics that we don't have as much written down in our community as we should about the resources that are available. I know that you can ask for advance directives, you can ask for forms from a legal office, but we don't have this information readily available or handily available. And I think this is something that Kinjal and I can take up for at least our community. And each of us listening in today can think about compiling these resources, at least whatever we can manage easily, and dispersing them to our community members, reaching out to elders to join our community groups. There used to be a lot of good that happened when we had joint families, that when we lived together as very close-knit communities. But a lot of that has been lost. And from your talk today, this is what I kept reflecting on, that some of these practices that were so inherent to our growing up and to our childhood, we need to reinculcate and reinforce if they are still alive. But thank you. This has been amazing. I think we need a follow-up next year with a further conversation on this topic and many more related to such topics. So thank you, Kaushal Bhai. I want to take a minute to introduce our SVNA team, because we've had a highly successful series of events between the start of the pandemic and even now. I was hoping that I would say the start of the pandemic and its end, but it looks like we are still facing some issues regarding that. Well, the best thing that the silver lining in the cloud of the pandemic has been our Zoom gatherings, and the fact that we were able to invite a series of speakers is nothing short of miraculous. And many of this is thanks due to our Silicon Valley Nagar Mandal or Silicon Valley Nagar Association team. And our team for 2021 is, of course, our president, Kinjal Buch. And I would like to mention all the names of the very active members here. They are Harshan Suhani Vaishnav, Shwetang and Maushumi Trivedi, Shivang Vaishnav, Smith and Rushali Mehta, Meghan and Wagmin Kachi, Kaushal, Shaunak Maru, Arjun Trivedi, and Dharmam Buch. So we have a lovely team of youngsters, and the elders in our community reap the benefits from all of their involvement. And I'm going to ask Kinjal to give us a few final remarks about this season of speakers that we have concluded today with Kaushal Bhai's speech. I just want to reiterate that the end of the season of speakers does not mean the end of events. We have many more events that are still happening this year, and many of them will be online until we need to have them online. Kinjal?
Thank you, Kaushal. Thank you, Sharwari, for a fantastic presentation. I think I personally learned a lot, and these are all, I think, how do I say it? We take things for granted, and we don't think on these minor things that are so important for all of us. And that's what you highlighted today. So thank you so much. I'm sure all of us have gained a lot. And we hope, like you rightly said, I think what's the point of reading in or listening in if we cannot apply it in our life? So we hope that we are able to, we have the wisdom to apply all of these things in our lives. Having said that, I think it has been a wonderful year. I think, like I said, COVID brought us challenges, and many of us tried to work around it. So at SVNA with my wonderful team here, we were able to bring so many we were able to discuss so many interesting topics, which I hope all of you enjoyed. We started off with, on the Otlaa Parishad side, we started off with Parul Kharod's nutrition related talk. We had our own Toral Desai and Shonak Maru here, local Silicon Valley born and brought up kids who who talked about resistance training. We had a wonderful presentation by Amrish Bhai and Resha Ben Kachi about pharmacy, the medications, and general knowledge about them. A lot of these presentations also had a lot of viewers asking questions, so which was very interactive. Arthritis, all, it has been that is a common issue with it, and Dhiren Bhai, was really, it was a great presentation knowing from him. Same thing with Dr. Chirag Pandya about the COVID and COVID vaccinations and all the rumors and all the things that are going around these days. And then, of course, recapping with Kaushal's lecture and presentation today. Among the professional series, we had a series by Krutarth Vasavra, Ricky Buch, again, Alay Yagnik, Atman Brahmachari, Ricky and Alay are Silicon Valley next gens for us. So it was really heartening to see all these youngsters participating and contributing. So with that, I think we hope we have we are hoping that more and more people can join and at least listen in to take advantage of these wonderful, this knowledge shared by our experts. I mean, we all should take pride in the fact that we have a very, how do I say, a community of experts who are enriching our lives on daily basis, and they have so much to offer. It is up to us how much we want to take from them and learn from them. And our effort will be to bring such series to you in the new year also next year. I think for a while we will take a pause in the sense of these professional CDs and the Otlaa Parishad, but like Sharvari said, our Navratri Garba event will come up and maybe something more also by end of the year. And then in January again, we start new year with new beginnings and new ideas and new energy. So any ideas that you all may have that you think will help all of us or will be very interesting to discuss about, please feel free to let us know, and we'll make every effort to bring some expert in that field to talk about it. So having said that, I would really like to thank and appreciate all the viewers who have joined us throughout the year, either every series or whenever they had time. And you have encouraged us in doing this. So we continued and we hope to continue. And not to say that, it is always better to meet in person, but either because of COVID, we are not able to meet, or because of distances, we are not able to meet. But that's okay. This platform has provided us an opportunity to connect, and we hope to continue to be connected either in person or virtually like this. So thank you, everyone. With that, we'll conclude today's program.